Good afternoon, everyone. We are letting everyone into the session here. So we'll give it just 1 second here to make sure everybody gets loaded up. My name is Marcy Timmerman. I'm the Education and Outreach Liaison for MHA Kentucky, or Mental Health America of Kentucky. We are working today with FEAT, which is the Families for Effective Autism Treatment, and the Kentucky Psychological Foundation Association, and KPA, I apologize as well. So thank you all for being here for this, this great webinar with all these lovely partners of ours. We love doing this kind of thing. We want to hear more about what mental health topics you want to know about, and we are listening. So let us know in the chat or via email. Let us know what we can do and bring to you to bring some more of these collaborative events. So we know that they're growing in popularity, which is great. And if there's other things and other questions you have, we're happy to be here to help you. Thank you to everyone joining us today. We're excited to bring together leaders to provide you with information that may hopefully be quickly beneficial to you and your families. We're going to do a deep dive on some pretty intense subject matter, though. So what you hear today is meant to help you to understand and work with some of the concerns around this topic. It's not meant to be medical advice, so be sure and stick around until the end to hear about resources to consider if your child's issues need further clinical attention. There are specialists who can help. We have 2 of them here today. So with us today is Dr. Rachel Buhner. She is our former president at KPA and the current vice president at the Kentucky Psychological Foundation. She's a board member of FEAT, the Families for Effective Autism Treatment, and Louisville's home of the Innocents as well. Dr. Buhner owns Bright Light Psychology, offering therapy and bright light evaluation services, offering ADHD and autism testing in Louisville. We're also lucky to have Dr. Alex Pruitt with us today. Dr. Pruitt has a great deal of experience with the treatment of mood and anxiety disorders, pediatric obesity, diabetes management, avoidant restrictive food intake disorder, anorexia nervosa, bulimia nervosa, binge eating disorder, chronic pain or illness, and fatigue syndromes, as well as trauma. So she's got a long list there, friends. Her specialty training allows her to work with children as young as 3 years old. She owns a private practice in Louisville, and thank you for being here with us, both of you.
Great to be here.
So let's go ahead and dive into this important conversation. Kind of set the scene for us, Dr. Buhner, if you don't mind.
Okay, so we have this kind of concern we often hear from parents. I work with a lot of families and a lot of individuals who have been diagnosed as neurodivergent, either with autism spectrum disorder or ADHD. And one of the common kind of themes that you will often hear is this fundamental issue about living as a human being, and that is eating and nutrition and getting what we need can often be an issue for families and individuals where neurodivergence is part of the picture. So you might hear a parent saying, my child will only eat 3 things, or if, one food touches another, it's like game over, or if I try to put something new on the plate, it's a whole battle. And it becomes sort of a battle of wills at meal times, and it becomes really kind of a spark for a lot of conflict and a lot of tension around meal times emerging and things like that.
Oh, Marcy, you're muted.
It's inevitable every meeting, right?
Yeah.
So I was wondering if there are other kind of challenges, especially working with ADHD and OCD folks that you find with feeding.
Yeah, certainly. So there are sort of the sensory components of things, and then, issues with regard to kind of control and feeling sort of certain ways and perspectives about sitting at the dinner table and meal times that maybe aren't shared by everyone. So it's really hard to understand what the individual, the child or an adult, depending on who we're talking about, is kind of going through, because you perceive it as, we're just sitting down at the dinner table. There's nothing wrong. It's just a regular meal. It's the same casserole I fixed last week. And we don't understand what is the big deal. What is the threat? So with regard to kind of bringing different types of disorders or mental health concerns to the table, their perspective, their experience of that meal, of that snack, is quite different from ours. And sometimes bridging that understanding and creating that perspective for parents and the people around that individual can be really helpful.
Yeah. Dr. Pruitt, from your side of things, are there feeding struggles that tend to show up with your specific families? Are they similar to the ones Dr. mentioned?
Yes, very much. I would say Rachel's painted a picture of kind of generalized issues. I want to bring up a few that I see often are some other sensory processing. Sometimes family meals are very difficult for the sensory sound system. And so chewing or hearing other people chew can be an issue. Having other smells of food, of not preferred food of that individual. So maybe dad's steak and broccoli is irritating the child who's eating their safe foods of macaroni and chicken nuggets. That can be hard. I would also say medication plays a really big role into eating and feeding a child. So, especially within the ADHD population, when we are on stimulants, a lot of time appetite's decreased. And so, by the end of the day, kiddos are super hungry, they're super hangry. That is a very real emotion in this population. But we're also unmedicated. So, somebody just said in the chat, not being able to sit and focus on eating or focused on drinking during the day, but it also happens at dinner time. Meds have worn off. We don't want to give them another dose because we want them to eat a little bit more. And so dinner manners may not be as on point as when the child is fully medicated earlier in the day or at a breakfast. So I think I work a lot about managing behavioral expectations of families around certain meals, whether we have meds on board or not. And also trying to look at following normal hunger cues. I get a lot of parents that worry the kids eating too much at night. It's like they're binging. And really, it's just the effect of not having the medication in. And if they eat 1,200 calories before bed, that's when we want them to be eating. Getting that food in is more important than when they eat the food. And so I think for these families, both with autism, ADHD, and OCD, we really need to kind of throw out conventional additives about like 3 meals, 8, 12, and 5. That's not necessarily when your kid is going to eat. And so you kind of do what works for your family while meeting nutritional goals and managing the comorbid diagnoses that they have or their neurotypical, or I'm sorry, neurodivergent issues that are presenting.
Yeah, I know the meds definitely suppress appetite for a lot of these kids, right? And that's part of that. So that's interesting. Just to point that out very, very succinctly, because you were right. I just think that was not maybe blatantly said. So, but yeah, no, that's great. Dr. Briner, we talk about the battle at the dinner table. Are there ways to reframe that and work with that or to intervene with that behavior choice?
Certainly. I think certainly. So I think a lot of the families or perhaps providers who are here with us today have the best of intentions. So we want it to be feel less of a battle. We want to make sure that children, that individuals have what they need from the standpoint of nutrition, that they're getting enough calories, hopefully that they're getting, the macro and micronutrients that they need, that they get what they need. It's a primitive need of ours as caregivers to make sure that kids have the nutrition that they need. And we equate love with feeding them and making sure that they have what they need. So this is really deeply ingrained stuff for us. So I think the idea that then you fix something that looks nice on the plate and you've put some effort into it, and then your child pushes it away and says no, can feel like a rejection, and it can feel like you're not doing something right. And again, at a very primitive level, it feels like a big failure on our part as caregivers. We take it really seriously, and then, the stakes just get higher. But for a child who has just been presented with a plate of food that you'd really like for them to eat, and they can see the expectation on your face, and they know that you've put work into it, and they know that they've had this battle with you earlier today or every day this week so far, suddenly we have an issue of they feel a certain way about what's presented to them, and you feel a certain way about what's presented to them. And while, again, I said a second ago, you're thinking, we're just sitting in our kitchen, and what's the problem? And this is something you've had before. Why won't you just this or that? For them, they may have very heightened kind of sensory things going on where their circuits are short overloaded, and they feel like, it's not just a plate full of food that they recognize. They feel like they're on a, just stepped onto stage and there's a hot spotlight on them, and you're putting something in front of them and telling them they're under pressure, and it's like their sensories, they're just in sensory overload. And at this point, we're turning off necessarily like good decision making, and we just feel like we're under threat. And again, I think that for those of us who are here today for this, or maybe watching it down the road in the library, the idea is we want for this to be a positive experience for kids. We want this to feel better. We don't want this to be a battle. This is a lose-lose at this point if they're not eating enough and we feel like we're doing a poor job. So reframing this as, instead of how do I make them eat it, how do I get them? How do I convince them? How do I punish? How do I, control? To instead think of it as a matter of how do I make them feel? How do I allow them to feel safe enough that they might be willing to consider it? How do I create a sense of safety around my child? How do I prioritize that sensation right now versus getting what I want?
That's great information. Yeah. I know
Can
that,
I add on to that?
yes,
'Cause
please.
I've got a point that will breach really nicely into the topic of shooting for flexibility. And sometimes I think we are looking at the kids' chronological age and not really where they are, maybe more emotionally or developmentally. We know kiddos on the spectrum or with ADHD can present a little younger emotionally. Think about when you fed your toddler. Like we didn't really care when they ate or what they ate as much. We would let them eat at 2 p.m., 4 p.m., and 6 p.m. at dinner, right? So again, throw out some of those rules that you have to only have 3 meals. If you get applesauce in them in a pouch on the way from school to soccer practice, that's a win, right? So then at dinner, they might just need chicken nuggets and a carb. And so I often will have families reevaluate those expectations that Rachel was touching on, being realistic and flexible by saying, look at your daily intake as your nutrition, not every meal. So I think as adults, we're trained to really look at carb, vegetables, fruit, dairy, protein, and we are supposed to have this well-balanced plate. For a kid on the spectrum or a kid with ADHD or OCD, we're looking at like the daily total. And then for even younger kids, sometimes the week, right? So if they haven't had a ton of vegetables that week, then maybe by Thursday, we're going to push the vegetable a little harder. But if they're generally getting a couple of fruits and vegetables, which can be smoothies, juices, easy fruit leather, pressed fruit, I don't really care. Dried fruit, candied fruit, it's still fruit. It goes in. We are getting that nutrition there. I think there's a lot of pressure about good foods, bad foods, the right foods. Food is not moral. It is about just getting wide, diverse nutrition and take that pressure off of yourself. And so, again, protein shakes in the morning with some fortified cereal, you're getting the kid off with a good start, even though it's not eggs and avocado toast. There's not a specific way you have to feed what works for your family on your agenda with your schedule and your parental resource. So I'm always asking parents, how much juice do you have at the end of the day to sit down and do this at 6 o'clock? Would it be better to do it at breakfast? Would it be better to get a more nutritious snack in before dinner because you're not as tired, they're not as tired? So I really work for the family with the family to find the best time to kind of push those nutritional angle or goals versus just getting the kid fed and having a pleasant dinner experience. If I'm ever introducing a new food, it's called homework time and it is not around a meal. And so, like Rachel said, I want that dinner time to be really a safe space and nice family time. That's what the benefit of family dinner is. If it's screaming and yelling or it's silent, that's not a beneficial meal. We want the hard new exposures to new foods or the difficult foods to be maybe at a homework time that's much earlier than dinner or an hour before dinner. So we work with families to figure that out.
That's some great advice. Yeah. I often hear from parents that it's just a picky phase and they want to push through it. And it sounds like that's maybe not the best choice. How can parents tell the difference though between that and when someone actually needs more support? Because their kids do go through a picky phase, right? Like every 3-year-old has their moment, right? But when is it a problem? When do we need to seek out some assistance?
I start to get kiddos when they failed OT, speech. Pediatricians are now starting to be worried. So a lot of times I'm like the last resort, and then they're coming really desperate, barely thinking it's going to work. So I try to say, if you're concerned, it's never too early to consult some resources, maybe even just reading some of the things I'll list later, or reaching out to get consultation from a feeding specialist. A lot of times weight is an indicator of a problem, unfortunately, which weight doesn't really give us a good insight into health. But if kids are not growing, obviously I get those referrals from pediatricians. They haven't made weight or they've lost weight. They fall off their curve. Sometimes you hear that language. Or if they're really higher weight. So within that avoidant restrictive food intake disorder, or ARFID, you can see a lot of kiddos actually very high BMIs, high weight because they eat chicken nuggets, French fries, and that's it. With either of those, we're going to kind of look at, what is the need first. And so if it's just calories, I'm going to start with safe foods and I'm going to start by just maximizing their intake. If they're healthy and they're, on the higher end and we're getting enough calories in, then I'm going to look at novel foods for nutrition enhancement, those different pieces. But I think when you're starting to really feel like you can't go on a road trip because you have to bring every food for your kid, traveling's a huge indicator to families. It's very stressful. We can't go to the zoo for longer than 3 hours because they won't eat anything unless it's at home. When you're feeling trapped, by the eating habits of your child, I think that's a great time to come see someone. Again, I've had a lot of pediatricians kind of downplay or minimize, oh, they'll grow out of it, they'll grow out of it. And you have to look at your kid's got a couple different things that are unique about them. And so eating is going to be a unique experience as well. We don't have to suffer with this. And I think that would be my big, if you're worried or you're feeling stuck or trapped, let's get help. There, it doesn't have to be a raging eating disorder or feeding disorder to come to a therapist to get help. It's about learning some of the strategies, managing your expectations and behavioral positive reinforcement that you can learn to shape your kids' eating experience to make it less stressful. But I always like kids to get a couple vegetables, a couple fruits. I don't care if they have more of one or the other. I
Mhm.
don't care the vehicle in which it is consumed. So if that spinach is in a smoothie, fine. If that carrot's in an applesauce pouch, great. And then with meats, a couple proteins and a couple carbs. They should be able to go to a restaurant and find something on the list. And I think those are my markers for like we have enough foods to be able to be successful in the world.
That makes sense. And Dr. Rachel, how does that work with the autism? Like, where is that intersection with that kind of RFID and more of an autism or neurodiverse area?
Well, I think Dr. Pruitt made some excellent points about some concerns to sort of look for and some indicators that there may be an issue where it would be great to bring in a professional. And again, you don't have to wait until you're absolutely desperate. But I think with the neurodivergent population, again, we have this understanding that a lot of individuals who are either diagnosed with ADHD or autism are experiencing the world a little bit differently. And I know I've mentioned this a couple of times, but I think it's really worth driving home. So we have, first of all, individuals oftentimes who are neurodivergent, they don't filter information the same way that we do. So as we sit down at the dinner table, and again, we're just kind of decompressing from the day, and the kitchen fan is on, getting rid of all the smoke from what you made for dinner, and the dog's out there barking, and somebody's going by with the mailman or whatever. We may perceive this as just a normal scenario in which we sit and we have our dinner. But to a child who perhaps is on the spectrum, they may experience it as deafening noise. Plus, now we're bringing in strange smells, and the kitchen smells weird, and everybody's running around. There's a lot of visual chaos and clutter, and we're being presented with a food with a lot of pressure suddenly on us. And the idea that we're not able to filter out a lot of the stimulation that's happening with us, so we may feel very overstimulated. So we have this position where what's in front of me and what I put into my body smells weird, looks weird, it's new, and there's a lot of pressure on me. And this is something over which I can have some control. And I definitely will let Dr. Pruitt say a little bit more about that element of it. But what we know is that for neurodivergent kids, oftentimes their ability to filter out stimulation, all these different sensory inputs, perhaps is a little bit different. And when you feel like you're overstimulated, it suddenly kicks in that kind of fight or flight response. So again, we perceive it as just, a normal night, but for a kid who's dealing with who is neurodivergent and dealing with this new food or perhaps some pressure around the food in front of them, this is a big scary scenario, and their body perceives it as a threat. So understanding that, and understanding that sometimes too there can be an element of feeling perhaps a little bit rigid and anxious around food and anxious around sameness. I like the same foods. I like it to be predictable. This is one thing that I can control, recognizing how high stakes it is for that child sitting there too. What can I do to create safety around them now?
That's great. Dr. Pruitt, did you want to talk about like that control factor and kind of that perspective? Mhm.
Absolutely. And when I'm talking about like a homework time to practice new foods, that kind of eliminates some of that pressure Dr. Rachel is talking about, that it is creating this spectacle at dinner, right? Which can be hectic, and maybe we have to leave the house for an activity, or we got to go pick a sibling up, and so there's pressure just already there. When we sit down and do the homework for an exposure food or novel food, we're really trying to eliminate some of those confounding variables or the other things that are messing up the kiddo's system to approach it. You brought up fight or flight, which is a great biological reminder. All your nutritional urges are going to go away when we're in fight or flight response. Appetite will be suppressed. And so, again, a kiddo's not going to be hungry, and they're not manipulatively saying, I don't want to eat right now. They're physically not going to be hungry if they're elevated in that fight or flight mode as well. So, some of this is just basic science. And I always ask parents to capture the food, the hunger times. If parents are being too rigid on a schedule because of sports or after school activities or something, and they're like, well, dinner's at 7, your kid might be really ready to eat at 5:30, and that's in the middle of practice or right before, but it makes more sense to eat dinner together at 7:30. Feed the kid when the kid's hungry, and that also can really help you feel less stressed about the nutrition going in. And so they might eat the bulk of their meal right after school when meds are coming off before a booster dose, but then 7, they could have a small thing at the dinner table. And I think that's something that a lot of families are like, oh, it's okay to do a snack at 7:30 versus a dinner at 5. And yes, what makes sense for your family? And just that permission to kind of make it make sense for their schedule and dynamic can be a really stigma reducing or compassionate way to approach this. And I also want to encourage people, you all have probably had some training or read some literature about working with your neurodivergent child. The eating should fall into the same category. They can't remember, 5-step commands. They can't eat 5 different foods on a plate. We should give them 1 to 2 choices. You can always add more food. So if you're worried or overwhelmed, they get overwhelmed easily, start with small amounts of the bare minimum. I need you to eat these 3 nuggets and I need you to eat these 3 apple slices. And your child's capable of maybe 5 and 5, but start with 3. If they're still hungry, they will eat more and tell you, or you can offer a third food. But I think, again, playing with this is something that families feel isn't allowed, or it's not good or perfect to set down all of the food at once. I see so many kids get overwhelmed with a full plate where if they could just focus on one food at a time, they actually would eat a lot more instead of putting all 3 foods on full portions. I also think a diet culture piece of this for feeding and overwhelming kids is from adult diet. We shouldn't drink calories. Calories being drank are totally fine. If your kid's drinking milk to get calories, or fortified chocolate milks, or protein shakes, or smoothies, completely okay. I know that dentists don't love that I say that, just make sure they brush their teeth. But really, liquid calories can be lifesavers for some of these families because, again, drinking calorie is not the same as another 3 nuggets on my plate. And so you can get a lot more fruits and vegetables in through juices than you think. And frankly, a lot of kids are never going to eat green beans, but they'll eat greens in a smoothie. So I just think you have to throw away some of the diet culture adult rules that we've learned about what's good and bad and throw it to the wayside. I don't care if my kids are drinking 100% Capri Sun juicy juices. They can have them whenever they want, anytime they want. I prefer that over water sometimes. The body needs liquid. It's not just water that they can drink. So I see that's a really hard rule for some parents to bend as well because of their own feelings about calories and what's right or wrong.
Yeah, I think that's completely fair. We do have a question in the chat. I think that relates to this probably directly. What about a child that doesn't eat any foods? They've got a child that's still on baby food. They're using baby cereal to thicken it. Is
Yep,
that
I
a good solution, or is there anything you want to add to
so
that?
it's does the person mind telling me how old the child is?
Oh, good question.
Let that sit. They can put that in there. I did have a 5-year-old, so going into kindergarten, who was still drinking most of their nutrition through a bottle, and they were drinking formula, and then they ate peanut butter and chocolate, and that was it pretty much, and sometimes Teddy Grahams. So I have gotten these kiddos. I mean, baby formula at 5, 6 is really, really delayed, and so some of that weaning just didn't happen during COVID. It was during an extremely stressful time. We didn't see our pediatricians as often. So some of these 6-year-olds, so I saw it was 6. That was COVID. When you should have weaned, we were all in distress. That we're in a national crisis. Be kind to yourself as a parent. You raised a little by yourself in seclusion. We didn't necessarily wean in the way or have support with that. I know I didn't have my kids in the pediatrician's office as often during that time. So first of all, be kind to yourself. If you've got a kid who's really stuck with fiberless foods, I do think that at 6, I think that's a time to go ahead and start seeking some help and start to slowly add in things. I really look at chaining, and chaining is a term that we take something they actually like, accept, or prefer, and we find a very similar food or flavor or texture. So if a kid's really into crunchy, then I'm going to stick on the crunchy side of things and not go for cooked mush peas or cooked green beans. Those are not going to be foods foods their kid's going to relatively take to. But a carrot and a red pepper or a crisp apple, that might be a way to start, because if they really like crunchy chips or pretzels, more likely they would take that for a fruit or vegetable. Opposite, if they like smooth textures, I'm looking for yogurts or blends or preserves of fruit that can be added to smoothies, right? And slowly we would start to put more grit and more chunks into a smoothie and work our way up to a more like fruit in a yogurt kind of cup way. Juices would probably be where I start with this kiddo, you know, and again, I know this is not medical advice. I'm not giving any actual advice to take home, but I think juices for a kid who's really limited is a nice place to start because, or a lemonade, vitamin waters. I had a parent the other day ask me about vitamins. My kid won't chew a gummy vitamin. I'm like, try vitamin water. Even General Mills cereals like Lucky Charms are fortified with vitamins. So again, think outside the box of how to get that nutrition packaged into a vehicle that your child will accept. But I would say that by 5 or 6, a kid should have more like 10, maybe 15 foods on. And I also think about, where are they going to school? What's that going to look like? Can they eat in the lunch line? Are you allowed to bring food in for that? Does that limit something? So a lot of kids get peanut butter dependent, but peanut butter is not allowed in a lot of public schools or schools because of nut-free campuses. So we have to get used to some butter, right? That's the alternative. So it's a lot about looking at the details of the person's life and what makes sense again for them. But we would start with kind of slowly integrating new things and getting the kid to get a few more pieces of the puzzle on there by having new foods.
Thank you. And Dr. Rachel, we were talking, how this is stressful for parents and families. Are there any tips you have specifically for handling kind of that stress and that emotionality tied up in this issue?
Absolutely. Well, first of all, you're not alone. You can see by the crew we've got here today, and this video of today's presentation will be viewed over and over again in the KPF library. So you're not alone. And I mentioned a few minutes ago, it feels like a deeply primitive issue that we should be able to feed our kids. Shouldn't be a problem if they're not eating. It's something that we are doing wrong, and it makes us feel like bad parents. So the thing about a diagnosis with ADHD or autism as a caregiver, as a parent, is you recognize pretty early on that things are going to not necessarily go down the typical path that you would expect as a parent, and in terms of developmental milestones and kids just clicking into place in terms of certain things in their life. And so we recognize that perhaps socialization with peers is going to look a little bit different and academics may be impacted. We recognize all these different ways that it's not going to be the conventional path, and that we may have to do things a little bit differently to prioritize the needs, well-being, and safety of our child versus doing the same thing that everybody else does. And sometimes that can be painful. Sometimes you look at how, you perceive things as being so easy for parents who don't have a child who's on the spectrum, or how they've never had to encounter or endure some of the kind of challenges that you have. Sometimes we just feel very different and like the road is so difficult for us. But one thing we know is how to work through a challenge. And so I want to kind of encourage caregivers and parents to think of this as, this is another one of those things where perhaps society tells you that you're supposed to give them 3 meals a day and make sure they're eating healthy snacks. And Dr. Pruitt mentioned a couple of times that, you're supposed to have your macros figured out and they're supposed to be getting enough protein, and a plate should look like this. This is another one of those elements of raising your neurodivergent child where it may not look typical. And if you can release yourself from the pressure of society says the plate's supposed to look like this, society says my kid's supposed to get this many calories at, like clockwork this way, and instead realize, what do they need? What are they trying to tell me? What are they scared of? What are they worried about? What's hard for them right now? What was a struggle for them over the course of the school day? And now here at dinner, we're having this showdown. How can I make this better, safer, easier for them? This is another one of those things where your brain, your programming, your society has told you it's supposed to look like this. And you have to give yourself a little bit of grace, a little bit of compassion, not always easy, and recognize, how do I prioritize their well-being here? Instead of what I'm supposed to do, how do I prioritize their well-being?
I want to put a eating disorder support group in for parents, and it's a wealth of information in the chat right there. So there's some online ones, there's materials through this. I see in the chat, a couple different things with commentary from other people. Like that can also be a really hard thing too. As a parent, we often are deflecting or defending our child's actions or explaining, and really we don't owe an explanation to anyone. And I think thanks for your concern. We got it handled. I just like nice short snaps backs of like, oh, are you reading, literature that's up to date on childhood feeding practices? Oh, okay, great. We are. I just think I'm probably a little sassy, but I would just think politely shut it down. Thank you for your concern. We have it. One thing that I do to really create less pressure, even on my own three kiddos, is I feed them what I want them to eat, and I've got two ADHD boys on meds. It's hard getting all those calories in. But I'm like, if we're going to a party, let's say a cookout, we got 4th of July coming up, and you know that grandma's going to say something because little Johnny's not eating the hot dog because it's got the grill marks on it, blah, blah, blah. One of these scenarios we hear all the time, and they're not going to have fruits or vegetables there that they're going to eat, then I'm looking at, hey, you can eat your carrot sticks at home and your applesauce pouch on the way. I don't care what you eat the rest of the time there. And we're going to try to get a couple bites of hot dog done. But I do what I worry about as my mothering those two boys before we even go to an event. And then I am not stressed. And oh, they ate before. That's also a beautiful comment. So you can deflect if the child, oh, they're not eating very much. We ate before we came. Thanks. And you can just sidestep that. So those are some tactics. I always have food in the car. I think food in the car is a big help because, like I said, look for that hunger. So when they say, "Hey, I'm hungry," you don't have to wait 20 minutes until you get home and make something and get it on the table. And 30 minutes later, they're not hungry, right? So it's always at my disposal, and I have, graham crackers that don't melt in the car and those kinds of things. To go back to one other thing about eating and drinking at school, again, I've written letters to schools about please do not make comments about students' lunches. I say send only preferred foods to school. Why? Because they're most likely to eat those foods. Put Gatorade in their water bottle. That's going to get them extra calories and a little bit of sugar. So if they're not eating well at lunch in the 20 minutes or 15 minutes they actually have at a table in a public school, then they can at least be getting calories in through the day. And one of the pieces that I talk about with send them Rice Krispie treats, send the Cheetos, let them get their carbs in at school. That's easy food to get in them, and they will eat all of it. Then we work on fruits and vegetables and proteins outside of school, and it's then less struggle at the end of the day because you don't have to also get them to eat their carbs. So I make lunch consumable by any means possible. I don't care if that's chocolate and peanut butter and Cheetos. Again, peanut butter sometimes can't go to
That's
school.
such a good point too, because I hear over and over that the cafeteria is one of the most overstimulating places that there is. So the idea that a child might feel like you've just packed what you feel is a really great lunch that the teacher is going to approve of, and it has all the, it's well-rounded and all these kinds of things. If they're overstimulated, they're not interested in the food, and it's just all too much. I think Dr. Pruitt makes an excellent point. Let's get the wins where we can.
And make the food open. Take them out of the packaging. If they're hard to open things, put them in little baggies for the kids. Make it very easy.
No, those are all great tricks and tips. Thank you for that. And just a note from an advocate here, I'm going to say that, you can advocate for your child to have a safe space to eat. You can
Mhm.
advocate for them to be provided with whatever food they need. If you're on the free lunch program, right, and there are certain things, go through the menu maybe a little bit earlier too, and help them learn to advocate for themselves that my mom says this, right? Or some phrases like that can be helpful to the students sometimes. So depending on their neurodiversity and their ability to do that and their age, of course, but just a note there, I couldn't help myself. So feel free to ask questions in the chat, folks. We're definitely open to discussing specific issues. Is there anything we haven't talked about already that you both wanted to make sure we address today?
I know we had a question right now about how to support each other as caregivers in the
Yes.
home. Can we touch on that? Because I had a little list of things I wanted to touch on. So when you are parenting or even a solo parent, you've got to have a moment where you can tap out. And I think that's so important for either two caregivers to understand, or as a solo parent, you figure out how can we tap out when you need a moment and take a deep breath and just take time out. I think it is absolutely mandatory for you to have easy meals. You should have some low pressure, easy meals. I do not care if they just eat ice cream and french fries for dinner that night. If you're at your wit's end, that is a better dinner for the kiddo to get down than you to be screaming at them to eat the applesauce. So, you recognizing your limits is really, really important. And as partners or caregivers, talk about, hey, I came home and I got 5% in my gas tank. I cannot right now with dinner. Where are you at? Or I got the first 20 minutes, but you're going to need to sit with them after that because I just have to do these other things around the house or at work. If you're parenting alone, really looking at managing some of those expectations. Things may move slower in a single parent home because resources are at half capacity. You don't have two adults to tag team. That's okay, but you need to have some other supports. Do you have a friend you can call? Do you have a parent that you can call and just cry to for a minute and then you feel better and go out? I really think about your parent resource and what you can give at that mealtime before you make the meal is really helpful because then you're not setting yourself up for failure. Set these kids up for success, set yourself up for success. How much can I really play at this tonight, or I just don't have the energy? Fine. I also want to mention we do therapy in spurts with these kiddos. I will see families sometimes every week in the summer because parents have more time and energy. They're not missing school, they're not missing work. They have that capacity to feed the kid throughout the day. We may gain 10 pounds over the summer, and then guess what? Come August, I don't see them until maybe October. And we do one, and then maybe over December we see one, and that's fine. This is a long marathon. This is not, just learning a new skill. It's a very long term. A lot of times kids can get into the groove. They know the novel exposure is coming. They get a sticker for it. 5 stickers means this prize. Positive reinforcement can be very, very managed for eating disorder people or for the eating pieces of this. A lot of people who've been through ABA therapy know that, or just good behavioral therapy is often talking about high frequency rewards. So a lot of this can be done at home once you get the concepts. And so it doesn't always have to be led by a professional. If you get that structure or that instruction from an OT or from a PT, you can just translate it into this subject basically.
And I want to say too, make a plug here for FEET for Families for Effective Autism Treatment. You will meet lots of families when you go to FEET events, whether your child's there to play a little bit of soccer with other kids on the spectrum, or take a swim lesson down in a pool down at Home of the Innocents, or learn to ride a bike, or the myriad of ways that feed offers fun opportunities for families. You will meet other moms and dads and caregivers who are kind of going through similar things. You'll exchange contact information. You'll recognize progress in certain kids and how well things are going, and you'll show up with support for other families. We do lots of moms night out with spa treatments and all that, and dads night out where dads can kind of get together and talk about their shared struggles and wins as well. There is support out there and there is community out there. The experience of having a child with a diagnosis sometimes can be very isolating, certainly. And as I mentioned a couple of times, sometimes it just feels like we should be able to get it better and click, everything should click better. And it can be really isolating. And the idea that you're here today watching this presentation, that you want to know some healthier ways to manage the conflict and make things feel better and help your child be as healthy and loved as possible, it says a lot about you. The idea here is if you need support, there is community out there. Additionally, I want to say that we would go to the ends of the earth to make sure that our kids have what they need. And again, you're here today doing this type of work. If you feel like you need support so that you can maintain your sanity, so that you can learn some new skills, so that you can have some new approaches and perspectives on parenting your child and having grace with yourself, if you feel guilt or shame because this isn't coming naturally to you, if these challenges are getting you to a point where you feel like you're not doing a good job and you're just piling shame on top of guilt, get a therapist, because as Dr. Pruitt mentioned, therapy is not always this linear, intensive experience where you're committing twice a week for 5 years. Sometimes you need a booster shot of support. Sometimes you get in for a few sessions, you get to unload a little bit, you get to kind of get some new perspectives on how things are going. If you work with somebody who's familiar with individuals on the spectrum or who are neurodivergent, you get some really solid skills that you can go home and implement tonight. You're not meant to do this alone. That no one is good at this right out of the gate. And if you need help and support, you're not meant to suffer. There are people out there who can make this load easier for you.
What an important message too. Yeah, because it can feel very alienating. Go ahead, Dr. Al.
I was just going to comment about these two lovely sharing experiences in the chat. One is a fear of choking, and then one is a medical G tube. And so that is a gastro tube that gets the child nutrition through liquid. And with my pediatric background, meaning I work with kids with chronic medical conditions, we do see these, and these are very different from ARFID, the avoidant restrictive food intake disorder. Now, choking can be a specific phobia. I choked on a hot dog, therefore I don't eat anything solid. So they're going to stay in a really smooth or liquid palate. Think about when you get your wisdom teeth out. So, mashed potatoes, yogurt, creamy things like that. That would want to be taken much more from a phobic treatment perspective. And so pure choking could be something that an anxiety specialist can work on, and that doesn't necessarily have to be a food therapist. The G tube, that would be more of an interesting take. And again, you would probably want to consult with your speech. I'm seeing that you are in that. But again, that might still be an OT piece. Is it an oral motor piece that we're missing? Or if not, and it's just this fear of novel foods, then potentially moving towards a feeding therapist. But I do think that choking in a singular incident and then we stopped eating happens a lot. And that can be managed by an anxiety specialist or somebody who works with phobias, children and anxiety. It can also, obviously, I do treat phobic choking hazards. But typically the choking happens all once. And so what we're trying to do is then get foods back on track that we used to eat. And so it's less of a novel food is scary. It's more the just getting the kid back to where they were. Where a child who's been on G-tube for a long time or had a medical condition. I've worked with some oncology patients, children with cancer that have just had, they were babies and they didn't really have that normal toddler weaning experience. And so now they're 6 or 7 and they're still having trouble doing that. We just do that. We got to wean them and we get back on track. So remember what I said about meeting your kid developmentally where they are. And if we've had a delay because of an illness or a phobic incident, just scooch back to where you are. If they're on, semi-soft foods, then we're going to just slowly start to get those lumps and bumps in the food, get texture in, and then just keep highly praising any change and moving them towards more solid foods over time.
Thanks for that. Yeah, those were good questions. Thank you all. Keep them coming. And I did drop our main links, the KPA, KPF, FEET, and MHA, and we can add any more. I'm sure there's other things that Dr. Alex has for us that are good books, resources, websites, things that we should make sure we're sharing.
Do you want me to talk about those now?
Sure.
Okay.
Unless I skip too far ahead, I'm sorry.
No, you're totally fine. These again are much more eating disorder, kind of more the ARFID realm of things, so not necessarily phobic books, but there's two books that we like and generally for ARFID. One is called Broccoli Boot Camp by Williams and Silverling. Buy it on Amazon. It's very easy. It's made for parents to understand how to kind of do this approach. Another is How to Nourish Your Child Through an Eating Disorder. And I know that word eating disorder can be kind of misleading because you're like, well, I don't know if they have a full-blown eating disorder. This book, though, How to Nourish Your Child Through an Eating Disorder, is by Sterling and Crosby. BIE is the end of that. This book, though, really talks about a plate by plate approach. And so it helps with that anxiety about overall nutrition and kind of breaking it down that you're looking at each plate today and how we want to look at food for your kiddo. So even though it has eating disorder in the title, don't get scared off. There's still some really great principles in the book for ARFID or for, weaning a kid into more solid food. And again, that was How to Nourish Your Child Through an Eating Disorder by Crosby and Sterling. For local treatment of eating disorders or ARFID, we're very limited in Kentucky. And so one of the things that I have worked in the last 7 or 8 years in is really working on getting better treatment for eating disorders in the state of Kentucky. I served on a council for it. We really lack it. So the only center in Kentucky that is a licensed facility is the Louisville Center for Eating Disorders, and they do have practitioners who can treat ARFID. They work with OCD, they work with autism, they work with the ADHD population. So they're really well versed in both of those. There is an intensive outpatient if it was really something that you wanted to do more head on. There's also another private practice called Aspire, Aspire Wellness. Aspire Wellness treats eating disorders. And then in Jeffersonville, there's another company called Aster Springs, Aster Springs. Those are all eating disorder facilities. And so they're going to have a little bit more of that edge on eating disorder, anorexia, or the picky eating ARFID. If you're looking more for the phobic stuff, though, I think that they can help absolutely. And so those are really it. We don't have many other resources. I'm happy to, keep keep giving resources on books and things. And then that website I already loaded was really good for the support of the parents and getting that, like Rachel said, getting that system and community found for you.
Somebody mentioned about reminding your child to drink water. I think it's a really good question. And there's this issue with some children who are neurodivergent experience just differences in how they perceive their own body cues. So interoceptive skills are, I can tell that I'm hungry, I can tell that I'm tired, I can tell that I'm hot or cold. Sometimes they're just not paying attention to those cues within their own body. So there are different types of reminders you can ask a teacher to gently, quietly, subtly cue your child to remember those things. Dr. Pruitt, I'm willing to hear any input from you on this as well. We recognize that that's not always going to be something that they remember to do. So providing loving, subtle, not embarrassing cues to do so can be really positive and helpful.
Make it a game, get a fun water bottle, make a sticker chart.
Get a bracelet where they can move the beads to remind themselves, something like that.
Absolutely. I also am not opposed. I know, I think again, this is one of those they need to drink water. Doesn't matter if it has Mio in it or Crystal Light in it. If it gets them drinking the base is water, then they're drinking water. They like watermelon, cucumbers, those are great things. Flavor the water. A lot of people don't like the taste of pure water. So I think it's looking at training and getting them used to it. We set goals for finishing one or two water bottles during the day. And it's a little game for my boys. Water, I think this is where sometimes we expect kiddos who are neurodivergent to be able to eat and drink regularly, but do we not have to also remind them to go to the bathroom a little bit more than frequent other typical kiddos? Like you're saying, Rachel, they're not in sync with their cues as much. My kiddos, if I don't tell them to go to the bathroom in the morning, they're like, "Ah, I'm gonna wet my pant," right? And it's rushing to the bathroom. It's like they still need this at 10. I mean, my kiddo's going into fifth grade, and this morning literally was like, "Wait, I'm gonna pee my pants." It's like you've been up for 2 hours. Go pee the first thing. So we're constantly working on building these daily living skills. Water's one of them. Again, car. Anytime you get in the car, everybody take a drink. And that's a really easy time. Transition times are good to reload on water. But make it a game, get a fun water bottle, get flavor they like. Those are all kind of tips that I work on. And slowly the body starts to say, hey, I kind of like this water. It will start to make it better. Do a pee test challenge. I know I talk about poop and pee a lot in my field. What color's your pee? It should be much lighter than this yellow. So if it's this yellow, we haven't won today. Get your pee as light as you can be. So you can have some fun with it in that realm. Poop, I make poop jokes, or if rocks are coming out, we got to have some more vegetables. Sorry, your body wants more, even though you don't like the taste. So we kind of talk about how the body's letting us know what it needs by your pee color and your poop size or stool breakdown. Sorry, I know this is a lunchtime lecture, but those would be things that I would kind of help your kid understand. The body is giving you signals of what it needs.
Oh, that's great. Yeah. And we're seeing some like hope-filled stuff about from one of our commenters talking about how her kids got better as they got older. This got easier. So that's wonderful to hear. I think for some of us, we need to remember that we're not in this alone, right? And that it will get better. And this stuff does build on each other. Is that correct, Dr. Alley?
It is, and I'm looking at it all builds on each other, and we naturally will start to remember and build that habit in.
Mhm.
Let's talk about the gut biodome for just a
Yeah.
second, because one thing that a lot of folks don't understand, we've got these prebiotics and probiotics and kombucha and all this stuff out there, right? The health industry likes to create fear, and fear makes you buy the things. What that really means for a prebiotic and a probiotic and all this stuff, we have good bacteria that lives in our gut, in our bowels, in our intestines. And when we eat certain foods regularly, the bowel starts making enzymes to break down that food. And so, what we want to think about is if a child has never had more than four foods their entire life, and then they've been G tube fed nutritional liquid, they don't have a ton of enzymes in their body to break something down. So if you give that child ice cream for the first time, they're not going to have lactate enzyme to break that lactose sugar down in the ice cream. They're going to get gas, they're going to get bacteria being very angry in their belly, and they're going to have a probably a diarrhea reaction. So what you want to think about is not necessarily that kids can't eat it. It's that they have to have a slow amount of that food introduced to the diet. So if people diet regularly and cut carbs out and then go eat pasta one night, then they say, "Oh my God, my stomach hurts so bad after pasta. I can't eat pasta." It's not that you can't eat it. It's your body stopped making the enzymes to break that down because you've been dieting, which you should not do. And I do not recommend anybody to cut out food groups. So, where you want to go with this is thinking about your child's exposure to new foods. And if they've never had a certain food, go very small, kind of like we do in infancy, what the infant books say. You do it for 3 or 4 days and you build up that tolerance. And those things are helpful no matter what age. So, if your kid is ready to start cheese because you want them to eat cheese pizza eventually at a birthday party, then start very slowly with some cheese and let their little guts get used to it while they are working on that new food. It's not necessarily a sign they can't eat it. It's that you have to move forward and eat it. Does that help with the?
I think it does. Yeah.
Okay.
Thank you so much. Yeah, I'm looking to see if there's anything else. That great comment about how a 10-year-old is marking the calendar each day with certain things that happen in our bodies. And just those kind of solutions, right? Getting creative, that gamifying seems to be a trend as well.
The gut can get pretty lazy too on things like Miralax or laxatives. Again, with kids, we want to use a stool softener like a Miralax or sometimes a pill. It's called a stool softener. It draws moisture into the bowel to make the stool softer so it's easier to pass, where a laxative is actually contracting the muscle for the body and then it's pushing out the poo. The body can get real lazy and sometimes it doesn't want to push out poo on its own if you stop the laxative. So really steer clear with laxatives unless you're prescribed by a doctor to do that. And that would be more like a bowel clean out. Think about colonoscopy prep. So that would be something that's more of a emergent full constipation in a kiddo. We need a bowel clean out and we're going to do massive bowel like a colonoscopy prep. Miralax is something that's great, but I think it's short term. Kind of think about it as jet lag. You might need some melatonin to get back on your sleep schedule when you return from a different time zone. Miralax is something you want to get going and use it like every 3 or 4 days for a while to get it going, but we want to be able to get the body more fiber or more water to balance itself and have the bowel movements. Some kiddos need it, and I'm not speaking, any medical advice here. Talk to your pediatricians or get a gastroenterology referral. But I definitely think that it's sometimes it's that lack of water piece people don't see, or like a fiber gummy or more fiber in their diet in a different way.
Thank you for addressing that. That was my next question. So thank you. Yeah. Dr. Rachel, is there anything you wanted to share as far as resources other than feet and the things that we've mentioned so far?
I think we're good. And Dr. Pruitt's practice has been up there. So if folks have questions for her specifically, she's given us a lot of really good information today, stuff that I didn't know either, and I will be able to implement as well. So thank you for that. And if you have questions, I really do recommend she's one of the best. Please seek her out.
Yeah. Awesome. Well, thank you both for all of this excellent information. Reminder, you're not alone, right? Feeding struggles are complex, and you're definitely not alone in this. My nephews are part of our system, so we've learned as a family how to handle this. And I think bringing in those support systems, right, that we've talked about before, keeping that open mind. Let's just kind of remind those things. We hope today you have a new way to think about things, and thank you so much for joining us, everyone.
Thank you.